in some women's womb, the fibroid is developing through inside the tubes.
So some people even mistake it for a child.
Some people even saying that yes, I'm pregnant. At the same time, some of them are seeing messes. At the same time, sometimes the messes will stop, thinking something is developing in the womb, thinking whether I have taken it, not pregnancy. Sometimes the woman may take it, and the pregnancy is not developing, and the pregnancy is there due to some problems. Before taking it, the woman may have some hidden sickness in the womb. We are Israelites. Many people laugh at us. Look at the years when the Israelites were moving in the wilderness. Do they have hospitals? They were using traditional medicines to maintain themselves. Exactly. Are they not giving birth? They were giving birth. Are they not curing themselves? They were using herbs. Till today, orthodox medicine practitioners, when a baby is breathed, they are waiting for CS.
Yes, straight.
They are waiting for maturity of the baby. But in Ijaw land, it doesn't happen.
There's a way they turn the baby.
Oh my God. Even the sitting down, carry head up. If it is 8 months, they will change the baby. They will change the baby. The baby will come a normal way when it's the time to be delivered. I am Ibola Thompson, alias Opuaro. I'm a physiotherapist by training. Okay. And gynecologist.
There are some women who have been going through little conditions, as very little, and they will go to places that they will tell them, you have to basically do 1 or 2, before having a child, but in Ijaw land, is it the same? The same way when someone is looking for the fruit of the womb, generally, how do you treat it?
In our own native way, if you want to look at a woman that is looking for the fruit of the womb, the diagnosis starts from the womb.
Okay.
After that, you diagnose the uterus and the fallopian tubes of that person.
Okay.
What may have been the cause why she has not been pregnant? And maybe there are blockages.
Okay.
It can be the blockage in the tubes. It can be the blockage in the uterus. It is by experience, some women don't even have a service right from the day of birth.
Wow.
Then some of the uterus are underdeveloped. Very small. They cannot take in fluid.
Oh.
So that if fluid is not going to the tubes to the ovaries, how can a woman take it? She cannot take it.
So situations like that, she can never.
She can never take it.
So there is no solution to that here.
There are solutions. Those are the solutions the area we are working on.
Oh.
That enable them to get pregnancy. So
I never knew that situations like that there can be, because in situations like this, if you are not a job, or if you not go to a job person like you, they say go and adopt, go and do IVF, go and do surrogacy. That's what they say.
Yes.
But in our case now here, as a job person, so there is solution to people like that.
There is a solution. A lot of people are coming here.
And they carry the babies themselves.
Some of them are 18 years, married for 18 years. Some are 10 years, 8 years, 5 years, like that. Some never ever dream that they can get pregnancy again. But when we come here, after the diagnosis, they will tell them the problem, why they have not been able to take it. And this is where you go about it, in our own native way. When they were treated in the native way, evacuate nonsense in the system, whether the blockage in the tubes, whether the service too small, we have to expand it. Maybe in some occasions, the POD, the house where the baby stay, full of water.
Wow.
And the woman is working with all these things. So at the time when she see our menses, the menses are falling into the vacuum of water. Without evacuating it, she cannot ovulate. If she ovulates, the heads cannot survive. So except when you do evacuation, bring those water that have been there, which is not supposed to be there. Where the water is the position where a baby is supposed to grow, fertilize and grow. So when you evacuate the whole water, sometimes gas will be there, sometimes the retained blood will be there. In some cases, some of them even have a fibroid or ovarian cyst. When all these conditions are addressed, then the woman is free. When she meets,
she takes
in. Because when we see the fluid started going into the ovaries, from the tube to the ovaries, then to fertilize the waiting eggs, then the pregnancy coming.
I am very particular about women because there are a lot of women who are going through, delay in childbearing. And I realize that there are some women who even after having intercourse or after having to meet with their partners, immediately they stand up, they experience sperm
coming down.
Yes, I don't know. A lot of women are going through this.
When the service is not open to collect sperm after meeting, they cannot go in. It has to come back. That means the service is faulty. And there are 2 or 3 ways why service is faulty. There are some women, the service itself is not in position. We call it a disposition of the uterus. Maybe it's cross. It can be bending to the right side of the pelvis or to the left side. Sometimes it can even put head down.
Wow.
So that the meeting at the sperm will just be hitting the body of the uterus.
And it will just be returning back.
It cannot go in. And another thing again, when the service, sometimes the service is too small, like a needle half, that the majority of sperm cannot go in, so it has to come down. And that is what Yoruba people call Eda. But what is the cause of Eda? Why the sperm is returning? It is because of these conditions we are explaining. In some cases, in some women's womb, the fibroid is developing through inside the tubes.
So some people even mistake it for a child.
Some people even saying that yes, I'm pregnant. At the same time, some of them are seeing menses. At the same time, sometimes the menses will stop. Thinking and something is developing in the womb. Thinking whether I have taken in, not pregnancy. So there are various of things.
Wow.
A lot of things are there. They want to have to diagnose, see traditionally. As we sometimes when I told people, we are Israelites. Many people laugh at us. And look at the years when the Israelites were moving in the wilderness. Do they have hospitals? They were using traditional medicines to maintain themselves. Yes. Are they not giving birth? They were giving birth. Are they not curing themselves? They were using herbs till today. Before this Orthodox practice of opening a hospital, drip, and other things are coming in.
You know that I've even come across cases of people who maybe they are pregnant and maybe the child stops developing. And they now take them to where they are supposed to be taken care of, and they tell them to go and flush. A child that can, because I know natively they can do some things on in some cases like that. Don't you worry.
It's happening. You see, sometimes a woman may take it, and the pregnancy is not developing, and the pregnancy is there due to some problems. Before taking in, the woman may have some hidden sickness in the womb, and those sickness is not allow the baby to develop. And sometimes when a woman taking, the cervix after taking is supposed to close. It's supposed not to releasing hair again. And if the cervix is not closed, it's still releasing hair, the baby cannot grow. Because the incubation system in the womb that giving heat to the baby to grow is reducing. It's like when somebody lacks strength, then you go to the hospital, they said you need oxygen. The baby need oxygen to grow. And how can we give oxygen to a baby in the womb that is not growing? Orthodox medicine practitioners, they don't have that wisdom. They don't even have that training. It's only traditional medicine practitioners. Like in our days of our mothers, when a situation like that occurs, they have medicines. They will insert it into the cervix. To block it. And the cervix will close mouth. And when the cervix closed mouth, then the baby started receiving temperature to grow. Then the incubator where the baby is now getting hot, warm, and the baby started growing. And there are some cases, there are some kind of worms. Yoruba call these worms Gynaecologist. Gynaecologist. The Gynaecologist is a two-headed worm in the womb. So when the woman pregnant is coming to lick the body of the baby, sometimes they will just bite the baby. They bite the baby. The baby started struggling. When the baby started struggling, it's coming down. As that coming down, the cervix is opening. Then miscarriage coming. These are some of the problems.
And these things have to be treated traditionally.
These things have to be treated traditionally. There are, what do you call it, traditional medicines, like we do them in the form of pepper soup or agbo. That one is just, they just prepare the medicine with herbs and they cook it. When the woman take it, it will go there and destroy the whatever worm that is there, that destroying the womb, that doesn't allow woman the baby to grow. Or in some cases, miscarriage. So when these things have been taken care of, then the womb is taken. A lot of them are coming here. Some of them that are coming here have got 3 times pregnancy. The pregnancy is coming down persistently. Then, okay, if that is the case, before taking in, you have not do an homework for your womb before taking in. Then the womb have to be cleaned up. Whatever sickness that is there have to be treated. When the sickness is away, you take in. Why baby will not stay? When the baby is comfortable, he have to stay for the 9 months before delivery.
Yes.
But when the baby is not comfortable in the house, and in the house where he's supposed to be, maybe rat and cockroach and mosquitoes, I'm just saying it.
Yes.
When disturb you not to sleep, how can you sleep fine? You cannot sleep fine. Exactly what is happening. When the baby is not comfortable, maybe worms, all this type of is disturbing the baby. And then maybe there are some bad odors, which we call infections. If there are infections in the system before you take it, when the baby started growing now, started
receiving the infection,
it become uncomfortable for him. And that is why most of the babies you see, we Ijaws, we have to be grateful to God.
Ijaws are very.
What they were trying away. 3 months.
To be why people.
To be why people. What I come on wall say, one no Juma Nimiko, one no Jumaga. Why? Because one is Jaboma. Temewe come Temewe Benebrame. Very, very different. It is different in the sense that without hospital, apart from surgery, we can take care of ourselves to a very high level.
Yes, to a very high extent.
Without even going to hospital.
You know, my biggest surprise as growing up as a child, when a woman is pregnant and a Ijaw man touches you, you already knows you are carrying a female or a male child. I don't know how it is being done.
By the wisdom of God.
Yes, that's the most shocking thing that me have seen.
And
without a scan, with just their hands, they know that you are carrying a female child, you are carrying a male child. That is a talent given to only the Ijaws.
When you see a pregnant woman, you doesn't do scan before you know whether the baby is sitting down or the baby is
standing, is cross.
Is cross.
Well, they call breech.
Whether it is breech.
Yes.
But the orthodox medicine practitioners, when a baby is breech, they are waiting for CS.
Yes. Straight.
They are waiting for maturity of the baby. But in Ijaw, it doesn't happen.
There's a way they turn the baby.
Oh my God. Even the sitting down, carry head up. If it is 8 months, they will change the baby. They will change the baby. The baby will come a normal way when it is time to be delivered. All these things we are enjoying in Ijaw land. Once you put your fingers on a pregnant woman, then the Ijaw man will tell you how many months, how much duration the pregnancy
and the
if it is 3 months, 4 months, 5 or 6 months, 7 months, they will tell you. But you have to go to scan. Sometimes scan himself is not too sure.
Yes, scan is
sometimes they fail. But Ijaw man or Ijaw woman who has been a traditional gynecologist, well gifted and specialized in the field, will tell you. It's a surprising thing to many of us.
Yes.
Like about is it not last week? A woman from she's from Kogi State.
Yes, sir.
8-month pregnancy. The baby is sitting down. Sitting down. The head is up. And somebody introduced me to her. And she had to come.
All the way from Kogi State?
No, Ikorodu.
Okay, she's Kogi woman.
Under, what do you call it? Under 48 hours.
She's a big bad.
And I charge her 50,000 naira. I charge her 50,000 naira. Even if 50,000 naira is not enough, but to tell them what we can do. Well, if it is CS now, for a woman to do a CS now, you talk of 100,000 of naira. You talk of 300 to 350 to 500 now.
Yes.